Hi, I'm Elena Forbes, Director of Advancement for the Conway School of Nursing and the National Catholic School of Social Service. Welcome to this edition of Cardinal Perspectives, an in-depth conversation with alumni, students, faculty, and staff of the Catholic University of America. Today, we're featuring a conversation with Alyssa Diaz, a 2021 graduate of the Conway School of Nursing, and Ann Vogel, Assistant Director of Young Alumni Engagement at Catholic University. After graduating, Alyssa began her career as a pediatric nurse at Children's National Hospital, located just down the street from Catholic University. During her time there, she encountered young patients who required or already had a medical port, a small surgically implantable device placed in a large vein, usually in the upper chest or arm. These ports provide long-term, more comfortable access for medications, blood draws, and IV fluids. As Alyssa explained the purpose of a port to children, she was inspired to write Penny's Port, her first children's book. Penny's Port tells the story of Penny, a 9-year-old girl with an implanted port who helps young readers understand why she has one, how it works, and shares tips to make infusion days easier. The book not only educates patients and their families, but also promotes body positivity for children at any stage of their port journey. Outside of her work as a nurse, Alyssa enjoys traveling, exercising, baking, and spending time with family and friends. In this episode, Anne sits down with Alyssa to talk about her time at Catholic University, her journey as a pediatric nurse, and the process of writing and publishing Penny's Port. Let's dive into the conversation.
Hi, my name is Ann Vogel. I'm the Assistant Director for Young Alumni Engagement here at Catholic. I'm here with Alyssa Diaz, class of 2021. We're here to talk about her experience at the nursing school as a student, as well as her new book, Penny's Port. Welcome, Alyssa.
Thank you. Thanks for having me. Me and Annie go way back, so I'm happy to be with you.
Yeah, thank you. So tell us about yourself. Where are you based? Do you have any hobbies? And can you talk a bit about what you do for work?
Sure. So I'm originally from Old Saybrook, Connecticut, and I'm an alumni here. I graduated in 2021. And so since then, I've been working at Children's National Hospital, and I work on a surgical care unit there with pediatric patients. And I love it. I love what I do every day. It's really great working with the kids and the families. And then, I've lived in DC now for like 8 years, and I love it. I like to run in my free time and travel, try new places to get food and stuff. Yeah, all that.
Thanks for sharing. So can you tell us about your time at Catholic? Is there anything particular that stands out to you, either with nursing or just with student life? And then can you share the most important lesson or concept you've learned from your nursing student days? And
I think the thing that stands out to me the most with the nursing school is I was able to go abroad for 6 months. I went to Australia, and it was such an awesome experience. I loved it so much. Like, I still talk about it to this day. Like, different trips I went on, things I learned there. It was a really great experience, and I'm really glad that Catholic gave us the opportunity to go to a different country for 6 months. Like, they definitely see the value in going outside of your bubble, seeing a new culture, new environments. I know they now opened the program to go to Rome, which is awesome. I was just talking to one of the nursing professors about that the other day. It's just awesome. So I'm really glad that they value that. And just, getting us out of our comfort zones, like a lot of the Martin Luther King, like service days, and just like all the service that we have like homeless food runs, stuff like that, that really helped me to, like, I've always valued charity work and, getting involved in the community. So doing that really inspired me to come here in the first place. And then it kind of instilled that, like, with my love of nursing, just caring for others.
That's so amazing. So I guess with that, is there any insight with your experience there or advice you'd like to share with current nursing students as well as fellow young alumni nurses?
Yeah, I think, just anyone in nursing, the nursing field is huge, so you can do so much with your degree. Like, you don't have to do bedside forever. Like, there's so many different fields in nursing, whether it's like adults, babies, children, or if it's like different, body systems and stuff. So you can do really anything, and it's not all bedside. You can do stuff like education, like I'm doing with my book, like something like creative. So I remember when I first started nursing, I've always loved to like write and read and do stuff like more creatively. And I kind of thought like, oh, I'm going to have to give that up like as I become a nurse, because it's more of like the science field and stuff. But that's definitely not the case. I was able to like use my creative like mind and put that into like use my experience as a nurse and put it into something to share with others. So I think just like the world's your oyster, whether you're in nursing or not, but specifically I know in nursing, like you can do so much with the knowledge that we have in our degree. You can go back to school, you can do stuff within your field and do education and advocacy. You could be a school nurse, you can be in the hospital, you could be in a clinic, you can do so many different things that make you happy, because sometimes it can be really, it can be a lot at the bedside for sure. Like a lot of people can get burnt out, and you don't have to like change degrees entirely. You can, if you still have a passion for nursing, you can put it towards something else within that field to make you happy and to help others.
Thank you for sharing. That's such insightful advice, and I'm sure people really appreciate that perspective. So let's talk about your book, Penny's Port. Can you talk about what inspired you to write the book and summarize a bit about what it's about?
Yeah. So I got inspired to write this book because I had a patient who I was caring for, and she was getting a port. And for those who don't know what a port is, it's basically it's under your chest, like right here, and it's like it connects to like a. I'll show you. I'm more of a visual learner, so that might help. It's a tube that's placed under the skin, and it connects to a vein. And it's a little like squishy part under your chest. So to get infused with medicine, which some kids need it for, like in my case, I had kids who had genetic diseases, and they needed these medicines to literally keep them alive. Like if they didn't take it, they would pass away. So it was like they needed to take this every 2 weeks or every week, whatever the specific medicine was that worked on their body, they would take it. And so they would get these ports, because unfortunately, if you have an IV, which most people get when they're at the hospital, it can cause, like if you're getting an IV a lot, it can cause damage to the veins. So a port is it's more like durable, and it's if you're getting infused a lot and need to get blood draws a lot and stuff, it's a good thing to have, so you're not getting poked all the time with needles. So it's like a little squishy thing under the skin. It connects to a vein, and then from the vein it goes to the heart, and then it pumps out like throughout. It goes in the blood, and the medicine goes all throughout your body. So it's for kids who get medicine or chemotherapy even. So that's what a port is. I hope that made sense. But so yeah, my patient was getting a port. She was 1 year old. She has a genetic disease, and she was getting IVs for the longest time, and she needed to be like 10 kilograms to get a port. So she finally reached like 10 kilograms, and finally like the day came that she was going to go in it's like a procedure that she has to be sedated for. They need to go in the operating room, and they need to place it there, and then she comes out. And the parents were very anxious. They were only like a year older than me at the time. They were young parents, and the mom wasn't even from the US. She was like from Thailand or the Philippines or something. So she didn't even have like family support here. It was just mom, dad, and the baby, and they were really anxious. So I knew that they were coming in because it was a scheduled procedure for her to get the port. So I was like, let me try and make it kind of like a positive experience, because, they're probably stressed, they're probably scared. So I found a book on Amazon about ports, and I gave it to them, and I like wrote a little note in it. But as I was reading through it, I was like, I feel like I could make something a little better. Like, I was like, I wish it was a little more descriptive. I wish it like had more of like a story to it. It was very basic, and it was cute, but I was like, I feel like I can make something better. So that's what kind of brought me to the journey to write the book. And I was able to find a publishing company, and they helped me with like the whole process of it. And yeah, it was a process. It took like about a year to like get this going. but I'm really happy about how it turned out. And I even let the parents know. I haven't seen them, but I told them like through one of the doctors that I wrote this book. I want to send it to you. So I'm working on getting that out to her just to be like, hey, you were my inspiration for this book. I just hope it helps a lot of kids.
That's an incredible story. Thank you for sharing. And that's just amazing that you were able to get it going and do it. So you did mention a bit about the publishing process. Could you talk a bit more about that?
Yeah, sure. So I actually found the publishing company randomly. I was walking through my hospital one day, and some patient wrote a book with his dad, and it was like sponsored by the hospital and stuff. So they were giving it out for free. And at that time, I already knew I wanted to write a book. I've been planning to write this book for 3 years. I had it in my head. I just didn't know how to go about the process of it. And then I even was trying to Google places that do this, or if I should just do it on my own or a publishing company. But then that book, I saw the publishing company, and it wasn't even that far away. It was in Landon, Virginia. So I was like, it's really close, so I should try. So I reached out to them, and I heard back, and they were interested in hearing more about my story. I gave them a little, I wrote it for them. They're like, give us a draft. So I wrote it for them, and I found pictures on Google Images to be like, this is what I want it to look like and all that. So they were like, yeah, this looks great. We'd love to, sign a deal with you. So I signed a contract with them, and my editor, she helped with everything. She just did the grammatical stuff with the story. And then I was able to choose through 10 different illustrators. And they're like, pick your style, and then they'll do a draft for you, and you can see if it is to your liking. So she gave me the list, and I picked 2, and then with those 2, they gave me drafts, and I picked 1, and I'm really happy with how it turned out. She did really great. And then with that, a lot of the medical stuff, a lot of people don't know what IV poles look like, or IVs or ports. So I had to really kind of specify. I had to send them pictures. Okay, this is what it looks like. I had to send them pictures of medical supplies so that it was drawn correctly. So there was a few drafts back and forth. That was the longest process, the illustration. And then after that was done, I just uploaded it on Amazon, and that was it.
That's great. Yeah, I guess I didn't realize how many steps it took, but the hard work definitely paid off.
Yeah, for sure.
Great. So as we're wrapping up here, can you share what maybe your vision is for the future of pediatric healthcare and perhaps educational content that you might create in the future, or for any other nurses who are considering doing that?
Yeah, sure. Well, just the last I haven't been alive for too long, but from what I've heard with more experienced nurses, doctors, is that pediatrics has been changing a lot in the last few years with just more education and science advancements and everything. So we're finding more cures to things. We're finding more medications that help kids live longer. So there's going to be things that were making kids pass away years ago. They're now they're able to live longer. So which is great and gives them more of a better life with medications we're finding and cures and stuff. So I think there's going to be a lot more kids around to care for, and more things that we can do to help them. So that's something in pediatrics that I've seen, just be years ago, a kid with this disease wouldn't be here anymore. So that's really inspiring to see.
And then what do you envision educational content looking like if you or other nurses plan to share more of it?
Yeah, I think the idea of books is great. Kids love books, so just having those graphics for them to read, and also just I think social media now. I actually have a social media page for this book. So social media, reaching out to kids that way to help educate and tell the stories. And now even I've seen different kinds of patient populations raising awareness on their accounts and showing hey, this is what a day in my life is like, and just giving more of an insight on how that is, and how I love listening to that stuff and seeing that, because I can get in more of the patient's head. Maybe they don't feel comfortable saying that stuff in front of a nurse. Like they can say it online and give us more of an insight of like, this is how I feel. This is what this pain is like. This is what my everyday is like, stuff like that. So that helps to make me a better caregiver and to help others be more cognizant of like, okay, this is, certain disease, like this is what they're dealing with. This is how they feel on a day to day. So yeah, I think just social media in general and the internet, that spreads a lot of information, and making more books. I'd love to make another book. I'm hoping to do one about G-tubes, which is a tube that goes in the stomach. It's a tube that goes directly to the stomach and gives kids feedings, because sometimes, well, kids and adults, but sometimes people can't, for whatever reason, if there's a structural problem, where there's issues with their muscles, like to swallow. They need to get nutrition somehow. So I'd love to do a book about like G-tubes and like how they work. On my floor specifically, we get G-tubes, and it's a whole process of making sure the parents know how to do the feedings, how to hook it up, what happens if it comes out, how to clean it, how to put a dressing on it. So there's a lot that comes with it, and if you have an easy book that's easy to read, easy to understand with graphics, that helps to like make it more fun, enjoyable, and have the kids say, hey, like this kid has one too, and it makes me feel more seen, which is what Penny's port does. Sometimes the port, it's under the skin, it can stick out sometimes, and people can feel self-conscious about that. But in the book, she's like, oh, I have a port, and sometimes people see it and they ask about it, but it doesn't bother me too much. I just educate them on what it is and what it's like to have it, why I have it, and it reminds me of how I'm brave. So it's really just trying to encourage, help with body image and encourage kids to like share their stories, show how they're different. Differences are nothing to be ashamed of. It makes us all unique and different. So, yeah.
That's incredible. Thank you for sharing. And then, I guess, as an alumna, how do you see Catholic University fitting in with all of that? You talked about the innovation in medicine, the research, the cures that have been found.
Yeah, I mean, just like I had a great experience at Catholic, and with more things that we're learning, I just know that they're going to inspire more nurses, and even in their undergraduate program, their graduate program, I see that like this new technology and stuff that they're using, and just new things we're finding. I know they'll be teaching that to the students, and that'll help them be better nurses, inspire others. And even in like the research departments, I don't know much about it, but I'm sure Catholic is doing different research with like medical, like drugs or diseases, stuff like that. I'm sure they're doing a lot of stuff to help, just the outside world. Yeah.
So when you were a student here, did you have a particular favorite class?
Yeah, so I did a program at Catholic called like the Spanish for Healthcare Certificate, which was throughout my like 4 years at Catholic. I did different classes. It was like 15 credits, I believe, and it was just different Spanish classes. It started with very basic like Spanish, but they focused on like healthcare words. We did like parts of the body, and just different like professions, stuff like that. Then it went to just like, conjugation stuff, like the normal stuff, all the different topics, but mostly focused on healthcare. And we also learned about like different diseases and, the names of it in healthcare and how to better educate. I also learned about like health literacy in Spanish and, different barriers that there can be with Spanish speaking families in the hospital, and their religious beliefs, cultural beliefs that can sometimes create a barrier in healthcare. So that was my favorite class. I mean, it was a bunch of classes in one, but it really helped me because I get Spanish-speaking families all the time. And sometimes we have interpreter devices, but honestly, sometimes they don't even interpret that great. And we have in-person interpreters, but sometimes they're hard to get. Like you can always get them, but sometimes it takes time. So if I need to say something quickly or something, I can use the Spanish that I learned to talk to them, even if it's just a little bit, because I'm not fluent, and it didn't teach me to be fluent, but it taught me words, phrases that I can understand and that I can speak. So I have a better time connecting with my families, and that makes it really enjoyable for me because it can be really scary at the hospital, especially if you don't speak the language. That just makes it like 10 times worse. So I love being able to speak to my Spanish-speaking families and use what I know. And like also sometimes you can list, like you'll hear them talking and you hear it and you're like, oh wait, like do you not understand something? And you can kind of help them better, because sometimes culturally they don't want to ask for much help, or they just like, oh, everything's fine, but it's like you can tell that's like really not. Like, do you want to like talk about something, or do you have any concerns? So yeah, the Spanish for Healthcare program was awesome. Like shout out to Jennifer Maxwell. I love her. She was a great teacher. She helped like bring this program to light. So that program I think is the most impactful because I use it every single day. I would say at least 3 patients I have a week, the families are Spanish speaking. Yeah, so it's a lot. I work 3 times a week, and I get about 3 to 4 patients a day. So just the fact that I have at least 3 patients a week that speak Spanish, it's really impactful to be able to actually use what I know from that class in the healthcare setting. So specific time that I've used the Spanish for Healthcare certificate in my job, I mean, there's a lot that I can think of. I think one time there was a patient I had and she was not doing well. Like she had a fever. She was like, her heart rate was going high. Like her monitor just kept going off. And I didn't have an interpreter device in the room at the time because, like I said, we get a lot of Spanish speaking families. So we only have so many interpreter devices, which is basically like a little iPad on wheels that we bring around. And I like couldn't find one because they were probably all being used. So, and then here her daughter is like, all the alarms are going off. She doesn't look good. She's febrile. She's sweating, like does not look good. Mom's like has a really concerned look on her face. And I'm able to kind of explain to her in Spanish, like she has a fever. That's why her heart rate's high. I'm going to get the doctors. We're going to like, they're all going to assess her. We're going to come up with a plan so that we can help her. I'm thinking of like antibiotics and, something to bring down her fever, like Tylenol. And I was able to say all of that in Spanish, maybe a little bit broken, but for the most part, I was able to get the key words. I was just able to say words like dolor, which is pain, fiebre, which is fever, tachycardia, like the heart rate, like, I'm able to say words like that to her and she understands. So it, like, I saw the look on her face. She was like, okay, like, this is what's going on. She was able to better understand. So that was a really great moment. Like, okay, wow, like I used something I learned in school to help a family. So that was like probably one of my favorite moments.
Great. And we are here in the brand new Conway School of Nursing.
Yeah. I wish I could have gone to or done classes in the Conway School of Nursing, but I'm really excited for the students to enjoy it and take advantage of it. It seems like there's a lot of new things happening that are going to help the students be better nurses.
Well, thank you so much for joining us, Alyssa. We really appreciate you sharing your CUA story, your nursing experience, your experience as a new author, and we really hope to see that vision in the future for nurses coming out of Catholic and for just the nursing world and pediatric healthcare in general. So thank you so much.
Yeah, thank you so much.